Hello and welcome. Thank you so much for clicking on this video. Today, let's do a nurse Q&A. Hello, if you have never been here before, my name is Mayela and I post videos here on my life as a nurse and thrifting. And today I'm going to be continuing a series that I started here on my channel. I have about 3 other nurse Q&A videos here, so go ahead and check those out too. And please let me know any other questions that you may have. Leave them down in the comments. And let's get to answering some questions. So I have a few questions here. I asked you guys over on Instagram to send me some questions, and you guys sent me a few. So I'll be getting through some today, and look forward to seeing more of these videos. So I plan on making this like a monthly thing, so maybe once a month I'll go ahead and answer some of your questions. If you like these nurse Q&As, definitely subscribe. I actually got to 900 subscribers today, just a few minutes ago, so that's really exciting. Thank you so much for being subscribed to my channel and supporting me and watching me here. If you already watched a few of my videos and you're not subscribed yet, what are you waiting for? Go ahead and subscribe. It's easy, takes a second, and it really helps my channel grow, and I would really appreciate it. Now let's get started. The first question is, what kind of nursing job did you have before becoming a public health nurse and before nursing? So I have a lot of videos over here on my channel, but I did make a whole video dedicated to my I've been a nurse for over 10 years now, and I walk you through exactly everything, all the different roles that I've had as a nurse, as a registered nurse. But briefly, I'll answer your question here. Before becoming a public health nurse, which I am currently, I did work at the bedside in different settings. So my first job as a nurse was in a skilled nursing facility, and then soon after that I went to a vent and trach unit. So I was managing a lot of patients that had tracheostomies, and I was managing ventilator settings, all that kind of stuff, breathing treatment and all that kind of stuff. Also on that unit, I did also become a charge nurse. So I worked in the PM shift, and I was a charge nurse for the unit. It was a 50-bed unit, and I supervised 7 CNAs and 7 other nurses, which included RNs and LVNs. And then I moved to another a subacute facility where it was really crazy. A lot of the patients there were, I would say, prematurely discharged from the acute care setting. A lot of them had fresh incision wounds. They were on IV antibiotics, all kinds of drains and tubes coming out of everywhere. So that was craziness. And right after that, I went over to a community clinic for the county that I currently work at. So that, I would say, that's like my gateway to my current position now. I work at a local California county health system as a public health nurse in field medicine. So I take care of our farm worker community here in our county. So if you want to see more of those, I have tons of day in the life of a PHN videos. So go ahead and check out my channel. I have over 100 videos currently. So if you want to learn more about what I do currently, go check those out. And the other part of the question is, what did I do before I became a nurse? So my first job was right after high school. As soon as I graduated high school, I already knew that I wanted to become a nurse. So I started doing my prerequisites at a community college, and at the same time I started a vocational program. So it was a dental assistant certificate program that was 3 months long, so not bad. And I completed that at the same time that I was doing my prerequisites, and soon after I was able to, I started working as a dental assistant for the same place that I did my externship at. And I did that all throughout doing my prerequisites and nursing school. So it did create a lot of flexibility for me. I knew that I wanted to do something in healthcare, and it was in healthcare. It was really helpful because it helped me start learning how to speak some of the medical terminology and just dealing with people who were scared, anxious, and learned a lot of sterilization technique and all kinds of stuff. So it wasn't necessarily medical, but it was in the healthcare setting. So I was a dental assistant. That was my first and only job before becoming a registered nurse. The second question is, what are your most used skills in your current role? So, I mean, I do a lot. So let's see, what are my most used skills? I guess I can narrow it down to the top two that I just come to the top of my head. So like I said earlier, I work with farm workers, so I am out in the fields and I'm going to their workplace, which are farms, or to their home. Some of these farms have housing in them, so it's also on farms. But the most, at least when it comes to nursing hands-on skills, is blood draws. So I do blood draws all the time. Mostly every day that I'm out there, I'm doing some lab draws, and I do them behind a car, on a bench. Sometimes we actually do have I guess like a small clinic in a building, and sometimes they come there, but the majority of the time I am doing it out in the community on the farms. So now I feel that I can do it with my eyes closed. Yeah, so that is one skill that is mostly used. And the other one I would say is probably just patient education. We see a lot of people who have never had an actual visit with a provider ever in their life. A lot of them are the majority are from Mexico, but not all of them. And even back there, they lived in small towns where there was no clinic, there was no hospital. So a lot of people we are seeing for the very first time. Some people haven't seen a provider in years, a decade. So I am doing a lot of patient education. So we are seeing people and finding them. They have hemoglobin A1Cs of 10 to 11%, which is really high. We're seeing people that have blood pressure readings of 180 over 100, really scary. So we get them connected to care. So myself with a nurse practitioner, and I am doing a lot of patient education after their visits with a nurse practitioner, before their visits. A lot of the time they get started on medications, and they get these new diagnoses of hypertension and uncontrolled diabetes. So I am visiting them frequently and just going over what that means for them, what kind of medications they need to take, what medications, and the frequency and indication for the medication. So my top two skills that I use are blood draws and patient education. The next question is a really frequently asked question, and I've answered it before, but I'll answer it again because it just keeps coming up. So the question is, do you need a BSN to become a public health nurse, or can you have a bachelor's in health science plus a RN license? So here in California, the requirements for a public health nurse to become a public health nurse is that you have to have a bachelor's or master's in nursing and a RN license. So I guess the answer to this question would be no, you cannot have just a health science bachelor's and a RN. You do have to have a bachelor's or master's in nursing for to become a PHN. And I have a whole video about what is a PHN, what is needed, where we work, what kind of education is required, and I'll pop that here and down in the description. So check out those other videos. That's actually my most popular video here on my channel. But I would always suggest for you to look at your state's Board of Registered Nursing website, because your requirements may be different than those here in California. And the last question I'm going to answer today is, what certifications do you need to be a PHN, and does speaking Spanish help? So first, yes, speaking Spanish definitely helps. Actually, my current role now that I have as a public health nurse, the job description when I found it was said Spanish speaking required. So it all depends on the community that you will be serving, but in my specific community I had to speak Spanish, so speaking Spanish will definitely help, so keep that up to date. And the first part of the question, what certifications do you need to be a PHN? I actually made a whole video on the process of applying for a PHN certificate. So public health nurse is a certification on its own, and it is something that you are eligible for if you have a registered nurse license, and also if you have a bachelor's or master's in nursing, at least here in California. So I would say you need a public health nurse certification to be a public health nurse. And I would say along with my role, I mean, I also had to have a registered nurse license and BLS. I think that's all the certifications that I needed to be actively working as a public health nurse. And also, just to let you know, your RN license and your PHN are both, I guess they both expire at the same time. So when you renew them, you renew both of them at the same time. There's no extra CEUs that you have to take for that PHN certification. You just do it for your RN and it transfers for both. There is an extra separate fee that you need to pay for your PHN. So make sure to keep that active if you do plan on applying for a PHN position or are currently in a PHN position. And that is the answer to that last question. If you enjoyed this PHN or nurse Q&A, please let me know by giving it a thumbs up, subscribing, leaving another question down below, or any video ideas. I'm always looking for new video ideas because I want to make videos that you will like. So leave them down below, and I do post a new video every Sunday. Go ahead and follow me on my Instagram to stay up to date with what I'm doing. I have some exciting stuff coming up related to nursing, so follow me over there. And I hope to see you on my next video. Bye.